Good morning. My name is Dr. Lesley with Boca Veterinary Clinic, and today we are discussing ear infections in dogs. This is an extremely common problem, and it is often very poorly understood. In order to treat it successfully, we need the owner, the doggy parent, to understand this condition better. This schematic illustrates quite nicely the difference between a healthy ear canal and an inflamed, infected ear canal. Firstly, the first question I get asked is, which breeds are predisposed to ear infections? And the answer is very wide-ranging. Firstly, any dog with a wide set head and a very narrow ear canal is predisposed because the ear canal is narrow. Secondly, any dog who has a floppy ear which covers this internal ear canal is also predisposed to ear infections because it traps liquids and inflammation inside that ear. So if we look at the dog that presents with one healthy ear and one infected, inflamed ear canal, the healthy ear canal is going to look more or less like this. This portion from here to here is the vertical ear canal. Down here is the horizontal ear canal. Together, these constitute the external ear canal, and this is where the majority of problems in dogs occur. In this healthy external ear canal, the ear canal itself is not inflamed. It is wide open, it is not red, it is not swollen. And if you had to clean this ear canal with a good ear cleaner, the ear cleaner would easily be able to flush out this entire external ear canal, both the vertical and the horizontal portions. In the inflamed, infected ear canal, we notice a few things. One, it is very red because it is infected and inflamed and the tissue is irritated. Number two, the sides of the canal are very swollen, so the opening itself is extremely narrow. The problem with treating this ear is that it's very difficult for medication to get into this lower portion, this horizontal portion of the external ear canal, and it is very difficult for the infection to drain out of the ear canal, simply because of basic physics. The opening is too narrow and there's too much pressure on the sides. So the goals of treatment are twofold. One is we need to culture the infection. We need to grow the bad guy. This bad guy, this bacteria or fungal infection, needs to be very appropriately treated with the correct medication. So we need to know what the bad guy's name is so we can treat it appropriately. Number two is we need to decrease the swelling. If we do not decrease the swelling, then treatment will not be successful in the long term, because the antibiotics or the medication that we're using will not be able to penetrate correctly and deeply and in sufficient quantities to this horizontal ear canal, and the inflammation and infection, this purulent material, will not be able to drain out of this ear canal. So we have to treat the infection and the inflammation. Now, what are some underlying causes of this inflammation? Well, the most common one is probably allergies, because this tissue is basically skin tissue. The ear itself is part of the skin which has folded into the body. And the way allergies affect the outside of the skin, they also affect this ear canal. And they make this very, very swollen. When this becomes very swollen, it is easy for infections to become trapped inside. That is probably the single most common cause. There are others as well. To summarize, we need to get rid of the predisposing causes if we can, such as allergies, and treat appropriately. Number two, we need to decrease the swelling so that our medication can get in and our infection can get out. And number three, we need to treat the infection itself appropriately for that kind of infection. If you think that this situation is occurring in your dog, then the best thing for you to do is to go see a veterinarian who knows your pet the best, because good care depends on three things. It depends on the owner. A good owner who's committed and observant and will diligently follow through with the recommendations is probably the single most important thing the dog needs. The second thing is a veterinarian with whom you have a good relationship and who understands your pet. And number three, obviously, the patient.